Well, one of the really key things about autoimmune disease, particularly something like lupus, is that we talk about lupus as one disease, but it's actually probably a cluster of multiple diseases with different drivers. But they just have similar symptoms, so we clump them all together. And if we're going to treat those patients well, then we need to work out which lupus patients have driver A and which patients have driver B, and actually specifically target those different drivers in those different groups. So we really hope that the work we're doing in these rare patients will help us to find biomarkers that identify patients who have kind of a problem with driver A or driver B, so that we can then identify those patients and treat them appropriately. The next steps in this research is really to, one, kind of identify some of those biomarkers that show us which pathways are dysregulated, and two, to really then go and look in autoimmune patients like lupus patients or patients with autoimmune cytopenias and see whether we can see the same drivers. And we hope that eventually we'll be able to roll these kind of tests out in the clinic and then be able to repurpose the drugs that we're using already in some of our PID patients to treat these autoimmune patients as well.